Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. We'll be off for Memorial Day and return on June 1st with Season 6. This summer, we'll continue to talk about living with COVID and the shift from pandemic crisis to endemic virus. We'll also continue to follow breaking news around new variants, the future of reproductive health and the Supreme Court, and humanitarian crises in Ukraine and around the world. We'll look at other urgent public health issues, including racism, gun violence, mental health, climate change, and overdose. And of course, we'll continue to cover the need for investments in public health infrastructure and surveillance for future pandemic threats. As we wind down Season 5, we have a few thank yous. First, huge thanks to our interns, Crystal Allen, Hannah Bennett, Maisie Conrad, and Caroline Wang, who bring fresh ideas and much needed support for the podcast. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast more than 7 million times. We appreciate all the great ideas and questions that come from our listeners. So keep writing to us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu. And thank you for being part of this podcast.
Back in June 2020, not long after the murder of George Floyd, I interviewed Professor Echo Yanka, a legal scholar and philosopher at Yeshiva University. Our conversation covered the crisis of legitimacy facing the police and the potential role of public health approaches in meaningful change. Now it's 2 years later. Professor Yanka joins the podcast again. We discuss how the optimism of the protests has given way to something very different. Let's listen. Professor Echo Yanka, thank you so much for coming back to Public Health on Call. We talked in June 2020 about police violence, police legitimacy, and the future after the murder of George Floyd. And I want to start by asking, it's been about 2 years. Has this gone the way you had expected?
I think disappointingly, it's gone the way I worried. Those protests were so large and so broad, and you remember as well as I do, there was so much attention to the interracial and broad nature of the protests that seemed to sweep our country. But one of the things that any criminal law scholar worried about, but frankly, one of the things that I think many African Americans worried about, whether you're somebody who studies this for a living or we're talking at your barbershop, was how dedicated were people really going to be to seeing change? Issues that affect the Black community in an everyday way transform the way people's lives are lived, the way communities are policed, and frankly, the way that Black people are seen just in our society are all too often something that's, of brief interest, a fad. And I think many of us worried that this would be, for so much of America, a kind of performative fad. And it has been disappointing to see how quickly this has passed from the public imagination, how quickly people decided, well, I did that 2 years ago. I did my march, without turning themselves to the real work it would take to transform the kind of real injustices facing so many Black people.
It seemed like for a period of time, there were some pretty intense discussions about the limits of policing, alternatives to policing, and there are some places that are continuing to pursue that. What happened, though, to the broader discussion of that? Do you think it was just a matter of attention moving on, or, people checking the box in a way? Or how do you make sense of the arc of what's happened?
Yeah, I think there are at least 3 things that happen. And off the top of my head, I'll try to move in order of less serious to more. Some of it is that in every movement, people are caught up in the moment. And that can be, frankly, narcissistic. There's a great op-ed by a writer I met, know, and really enjoy The title of the op-ed in the Washington Post was "When Black People Die, White People Start a Book Club." And frankly, the article was much more elegant and subtle than that. But his point was, if your interaction with the way in which other people are being harmed is to, sip Chardonnay, talk a little bit about it, and then feel better about how you feel, that's not a serious engagement with that other people are being harmed. That is to make yourself feel better. The second, of course, is that, this set of protests have happened during an incredibly difficult time. Of course, they were born in the midst of a pandemic, but this pandemic has seemed interminable. It's been exhausting, and it's worn at our cities in really predictable and unpredictable ways. And so we have seen people simply, I think, run out of energy, and seen people facing the headwinds that the pandemic has brought, including, we should be very clear, a really startling and heartbreaking increase in violent crime. Criminologists can quibble about whether or not all crime is up, but people don't care about whether or not bikes are being stolen if young people are being gunned down in the streets and bystanders are being killed. And so that has made it very hard to think coolly about creative and progressive ways of policing. But the third thing, of course, is that there was a predictable backlash to efforts for reform. So, the fact that we've been doing policing in certain really unproductive ways, in ways that we have studied and seen don't work and cost huge amounts of money and destroy lives and communities, and have done it one way for a long, long time, you would think would give us the bravery to try new things. Instead, what you saw was, especially in the face of rising violent crime, people saying, oh, look, it's those liberal reformers and their feel-good ways that are responsible for this. And often doing so in ways that were just disingenuous, right? The fact that two cities, whether it be Chesa Boudin in San Francisco, is experiencing a homelessness crisis, but so too is the old-fashioned, hard-on crime prosecutor in Sacramento. But it's an easy story to tell, a backlash story about how it's the progressive prosecutor that's undermining public safety. And I think those three things have meant a lot of people have just turned their attention elsewhere.
There are grants being given, model programs being launched in some places. It is below the radar. It seems like what's on the radar are extreme positions on different sides. The hope, though, that there could be a reshaping of policing and a different approach to legitimacy in police seems to be lost from the major discussion that's going on. Do you have any hope, looking at some of the activities below the radar, that maybe that's a place where seeds can be planted?
Well, I think two things are true, right? One is that what I've said about the challenge of this applies just as much to me, you, and others of us who are trying to make the system better. This was always going to be long, hard work. I mean, this is to try to rebuild public safety and complicated issues in ways that are going to sustain communities and secure public safety. I think one thing that the sort of reactionary groups have, the people who say, no, just more of the same, is they have a super simple story to tell, right? More cops busting more heads on the street will make you feel safer. And the fact that we can show demonstrably it's not true doesn't mean their story isn't simple and accessible. So there is a challenge on people who want to see change to both be prepared for the long, hard work ahead, but also to find convincing, compelling stories. And so I think, to the extent I have hope, it's those two things together. We have to know that this is going to be hard. This is going to be slow, right? The excitement of youth gives way to the seriousness of, middle age, I suppose, I'm feeling. That is to say, the things that sounded great in your college dorm room, as though you could wave a wand and make them happen, require one running for office or organizing on the streets or becoming the head of an institution and changing. It's going to be long, slow work. And my hope is that we are up to that serious task. But it is, as you say, it's shepherding or gardening, nursing grassroots. Yeah, absolutely.
One of the things you said that stuck with me from 2 years ago is that what gets treated as a crime in one community gets treated as a call for help in another community. And we have to see it as a call for help everywhere. And we have to really support people with the kinds of services that don't exist. And, I think that has remained a goal in some places, but that kind of line of thinking has faded from the major discussion that's happening. And, I really do struggle to understand why. I think one of the major goals of public health is to try to center that concept.
No, you're absolutely right. I mean, look, it is really stunning. And it's, when people talk in very abstract terms about institutional racism or structural racism, it can seem very abstract. And in part, it's because if we speak honestly, have now grown to have a society where people are more troubled by being called racist than by doing racist things. We should speak honestly. When people see poor Black people in a park sleeping on the bench, there's a kind of built-in American contempt. What is wrong with those people? Why don't they pull themselves up? When people see poor white people sleeping on the same bench, it is leavened, not erased, but leavened by a kind of sense something must have gone wrong. You and I, for example, have had long conversations about how this played out during the opioid epidemic. The opioid epidemic has not perfected the way we treat drugs. There's no question we still police this in unsound ways. But it is true that the national timbre of the conversation changed to saying something is going wrong in these communities. When drug epidemics, in particular the crack cocaine epidemic, hit the Black community, you don't see that at all. You didn't see any serious, sustained national conversation about what was going wrong and how it was a cry for help. We now have heard the terms deaths of hopelessness in a way that just was never permitted for Black communities. And I think that is true about policing as well. When you see, when we see white kids roaming the neighborhood with nothing to do, people think they need an after-school program. When we see Black kids doing the same thing, we think they need policing. And I'm not saying it's 100% one way or the other. There are countless people, in particular in Black communities, working to build after-school programs. And there are some people who look at white communities and say, we should police those kids too. But the national scale is nothing like the same.
So we're at this difficult point where people's attention and motivation has waned to address issues of police legitimacy and violence, where we still have trouble seeing that people in similar situations both need help first. We treat things differently on the basis of race, as well as other characteristics sometimes. And on top of that, we see this surge in crime, which is making very simple stories and reflexes come to the forefront again. For people who are committed to change, who want to imagine that what happened 2 years ago was not just a flash in the pan, what can we do?
So, look, I think one of the things that frustrates me is that it's awfully easy for people to readopt, as you say, simplistic language. Hard on crime always sells. No politician seems to lose very much on hard on crime. And one thing I think we need to do is to admit that these things aren't easy, right? So I have spent a lot of my professional life, when I'm not just in a classroom or writing papers, thinking and working in communities in order to bring these ideas to life. And the thing you realize is in the real world, these things are not easy, right? I mean, it is hard when you are in the midst of young people experiencing another shooting in Brownsville to know what the right answer is. I've been on panels with mothers who've held their dying child in their arms, trying to literally hold this child's body together. So, I reject the idea that, our job is to provide some simple and clean answer. And frankly, I think those who are desperate for public safety first should be, partners in this. Nobody wants safer streets more than beleaguered Black communities, right? I mean, part of the narrative that reformers don't care what's actually happening in the streets, or the kind of easy thing that you hear the mayor of New York say, Black lives only matter when a police officer shoots a Black child, but why don't they matter when, there's gun violence in our streets? It's just laughable. I mean, it's actually disrespectful for a mayor to say something like that when he should know, if you go into any Black community on the weekends, there's a reason people are working tirelessly to decrease the violence. So yes, we understand that the first and foremost thing is to address this huge surge in gun violence, and that matters to nobody more than the Black community. That being said, we should stop pretending that the ways we've done things forever without success are going to be the ways to go forward. We should look for ways of answering the fundamental causes, even while we try desperately to stop the way violence is on the streets. And those things take real imagination and real investment, and frankly, a lack of contempt for a community, as though the only thing that could support this community was policing. If you ask Black communities, they will tell you go either work in the community or read the scholarship. It's not just the police. It's that the new mall opened down the street with nicer things to buy and attracted nicer people. It's balancing gentrification with access. It's the new park. It's the new lighting. It's the new after-school programs. If the rest of the country had the imagination for the Black community that the Black community had for itself, it wouldn't be so hard to think of a life and a way forward.
So in part, it is recognizing how hard this is, embracing the complexity of the challenge, but it also is in part to make sure that communities are part of the solution and are having a really big voice in the different kinds of programs that are tried in order to do things differently.
That's absolutely right. Look, I'm not here. I know that I would do better and get more clicks if I could tell people there was one simple answer and I happen to have it. But I'm not here to do that. I am here to say we're tired. We should be tired of the only simple answer being, let's do to this community the things we would never do to any other community, right? Let's just throw more cops at them. It's not trivial to point out that when the worst things hit other neighborhoods, we don't have this sort of simple, unifaceted answer, right? We think hard about how to both stop the violence, but how to make the community healthier from the ground up. And it's only when Black communities ask for the same thing that they're seen as wanting a handout.
Well, this is a difficult time. This is 2 years after the murder of George Floyd, and we're talking about the immense challenges in seeing even basic progress on some of the issues that his death raised. We will check back with you, Professor Yanka. I hope that we do see a shift, not only in the national dialogue, but in the commitment, the funds, and the realization that this is a fight that we all have to be engaged in. So thank you so much for joining me today.
Thank you for having me again.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.